Welcome to the Physician's Guide to Doctoring podcast, where Dr. Bradley Block, otolaryngologist, interviews experts in and out of medicine in order to get their take on how physicians and all healthcare practitioners can better help their patients, practices, colleagues, communities, and most of all, themselves. The ideas expressed on this podcast are those of the interviewer and interviewee and do not represent those of their respective employers. This podcast is intended for medical professionals. The information is to be used in the context of your own clinical judgment, and those on this podcast accept no liability for the outcomes of medical decisions based on this information. As the radiologists like to say, clinical correlation is required. This is not medical advice, and even though the magic of podcasting may make it seem like we're speaking directly in your ears, this does not constitute a physician-patient relationship. If you have a medical problem, seek medical attention. And now, Dr. Bradley Block.
Welcome to episode 4 of the Physician's Guide to Doctoring podcast. We're here with Jason Hare, the Patient Experience Coordinator for Glens Falls Hospital. I've known Jason basically my entire life, and I've always known him as an entertainer, so it seems appropriate that he's involved in something like this. But Jason, tell us, how did you end up in that position?
Sure. Well, first of all, Brad, thanks for having me on the podcast. I'm excited to chat with you about this today. So I've been in the patient experience coordinator role for just under a year at Glens Falls Hospital. I've been in healthcare now for almost 20 years. I started off in credentialing in the medical staff office at a hospital for special surgery in New York City. From there, I moved on to the healthcare tech side of things, the for-profit side. I worked at ZocDoc. I helped run their customer service division for about 6 years, and recently moved from New York City to beautiful upstate New York, and was really excited to get back into an area where I would have more direct contact with patients in a very direct healthcare setting. And it's a great role. It's a great role to have.
So this is something that's really rapidly emerging in the healthcare field, where we're recognizing that something that we've been lacking for a long time is customer service, and we're taking cues from industries that have done that well. So, I think that your role is really hugely important, and so I think we should explore what that entails. But you had mentioned before the podcast that we should define what the patient experience is, which I think belies the fact that we as physicians may or may not have the same perspective as the patient on what this experience is. So let's if you could define that.
Yeah, absolutely. So I think you're absolutely right that this is more of an emerging thing now, and it does have ties to customer service because, like it or not, our patients are consumers and they have choices. There are lots of sites, like ZocDoc, which I mentioned, Health Grades Vitals, whether those reviews of providers are fair or unfair, they're giving patients a voice and they're giving them a choice in their healthcare. So patient experience does have relations to customer service. I think what is a frequent misconception of patient experience is that it's patient satisfaction. And I don't think they're the same thing. I think that patient experience is not actually about happiness. Because we're in healthcare, we work in doctors' offices, we work in hospitals. We can't always make patients happy, and that's okay. There's no real universally recognized definition of patient experience, but one of my favorite ones, which was said by Patrick Ryan, who's the CEO of Press Ganey, who I'm sure that company is familiar to some of your listeners, is what he says is that the patient experience, it's not about happiness. What it is about, it's about patients, and I'm going from memory on this here, but it's about patients being cared for, communicated with, respected, and having their care coordinated in such a way that they can get the best possible clinical outcome for whatever their circumstances are. So it's about, communication, it's about care coordination, it's about respect. And when you look at patient experience in that way, you're looking at helping patients and their families reducing their suffering. You're helping them reduce suffering and reducing anxiety. And in order to do that, what you have to do is you have to look across the entire continuum of care. It's not just the doctors, it's the front staff, it's the nurses, it's the techs, it's the website, it's the answering service, it's all of those things. So patient experience is really about delivering truly patient-centered care, and it's about care that is also safe and really high quality care. So again, not about making patients happy. I don't expect patients to be walking out of my hospital smiling and tapping their toes and with a big thumbs up. If they are, that's great. But ultimately, what I think it's about making patients and their families feel cared for and feel respected and feel like their dignity has been honored. And so I think that's what it is.
So you want them to walk out feeling like they've been heard, they've been understood, and that they understand their care and that they're making the right decision. Because your outcome you might get the best care possible, and your outcome might not be great, but as long as they understand that that's a possibility and that the person that was looking after them really had their best interests and they got the best care by someone who genuinely
Absolutely.
cared about them.
Some family members will walk out of the hospital without the patient that they brought in. That patient may die. But you can still walk away from that experience and say, obviously, this is not an experience that makes me happy, but we had a good experience here. We felt respected. We felt cared for. We felt our loved ones' decisions were respected. That kind of thing. I think if patients can walk away feeling like that, then you're on the right track.
So I don't think any physician would disagree with that. But I think the ways that we can accomplish that would be up for debate, right? So what are some simple things you think that we could do to improve what we're doing already? So as a physician, I certainly want my patients to feel like I care about them, feel like I'm doing everything I can in their best interest and doing everything I can to make sure that they understand what's going on. But clearly there's sometimes a disconnect between those two things. So right now, I'm just talking about not the ancillary staff, not the rest of the experience, but just that doctor-patient relationship. Do you have any tips for me so that I can make sure that they really feel like I care about them and their concerns and make sure that they leave understanding what's going on? Also, respectfully, in a time efficient way.
Sure. And there are, it's easy for me to say, these are the things that you have to do. And doctors can very rightfully say, but I have all of these other things I have to worry about. I've got a patient roster for the day that is, down to the ground. I've got so many patients I have to see in this time. But at the end of the day, if you're not taking the time to make that one patient that, is your most important patient at that time, right? If you're not taking the time to make that person feel cared for, then what's the point? So yeah, as we've been saying in this discussion already, ultimately, what do patients want? They want the same thing that your kids want, that your significant other wants, that your coworkers want, and they want to be heard. So there's no faking that step, or you have to be very good at it to fake it. There's ultimately, you have to make sure that your patients are heard. In terms of the kind of the quick and easy things that I think can go a long way in making that happen. So here are some suggestions. Number one, before you walk into that room, take a deep breath. Just take a second to let everything else go. You got to let go of that patient list in front of you, because right now the only patient that's important is the one that you're about to see. Let that go. Let whatever happened before go. Make yourself centered to meet with that patient. Come in, introduce yourself to the patient, and introduce yourself to the family. The family is equally as important as the patient. Because just from a practical standpoint, when they return those surveys or they leave their comments, a lot of the time it's not the patients leaving those comments. It's the family member that's doing that. I'm in a role where I see complaints and concerns come in from patients all the time, and it's their loved one, or their spouse, their daughter, their relative, someone like that. So make sure you're introducing yourself to patients and family, who you are, what your name is. This is a pet peeve of mine, to be honest, when doctors come into a room when they're seeing me or they're seeing my kids and they don't say who they are, and they don't start with that. Make eye contact. Make sure you're making.
That's an excellent point. Actually, as a physician, I just assume that they know that they're here to see me, right? Who'd they make an appointment with? They made an
Yeah,
appointment to see Dr. Block
that
at 10:30. So when Dr. Block, when someone who looks male walks in at, just because I assume they can see my beard on the picture when they make the appointment, they when I walk in at 10:30 and they assume that I'm Dr. Block. Now, this certainly some of my female colleagues have problems with that because there's this, they'll sometimes be mistaken for nurses, which is
right.
clearly a problem. But yes, I assume that when I walk in the room, they know that I'm the doctor because they made an
Sure.
appointment with me, right? I didn't make the appointment for them. But clearly you're saying that that's a mistake on my part. And so something that I need
Yeah, I
to,
think so,
I
because
certainly
when you
need to get
think
better
about
at.
it, some of your patients are booking with you directly. Some of them might be coming in through a referral, right? So they're told you're going to go see Dr. Block is the same as Dr. Smith is the same as Dr. Jones in terms of all that, right? So there could be that. There could have also been 3 or 4 people that came in to see them beforehand. My daughter just went to see an ENT, and the nurse practitioner came in first. And it was a little confusing at first when the nurse practitioner came in. I thought, wait, is this the person I'm seeing, or are we going to be seeing somebody else? So there's that as well. But the other thing to keep in mind is that often patients are in pain and they're scared. So their faculties are not going to be at the same level that you might expect them to always be, especially if you're in an area, like a really emergent area, right? You're in the emergency room or something like that. So I think and also it's just nice manners, right? Like it's just nice manners to come in and introduce yourself to someone. And now you're creating, the minute you do that, the minute you look them in the eye and you say, hi, I'm so and so, and you maybe confirm their name for them. Are you John? Are you the patient? And you introduce yourself to the other people. You're saying, okay, we're here, we're present in this room together, we're creating a relationship. We are starting our relationship right now. And even doing that can help put people who are in pain and frightened at ease. So introduce yourself to people, make eye contact with them, right? Don't be looking away. I mean, obviously you got to look away to make your notes, write in your computer, write in your notebook, obviously, but make eye contact. The other thing that I really like is, and I know this is not a new thought, but is to sit at eye level with them when you can, right? Try to, if there's a way to do it where you can sit at eye level and not have your back to the family, you're in great shape, right? Because the family is really, they're potentially a very large part of the care plan. So you want to involve them in that.
Yeah, the electronic medical record definitely makes that
Sure.
challenging, and we hear lots of complaints. Oh, it's a barrier between me and my patient. It's one thing that I've found useful is dictation software. So I use Dragon. So I receive no, to full disclaimer, I'm not being reimbursed for this, but something that I've found useful is, rather than sitting there typing, although certainly I sometimes do if I have to make notes, if it's a complicated story, but I'll listen to the entire story, and then I will dictate back to them what I heard, so that shows that I was listening and they were understood. And this is what their story actually sounds like when said in chronological order, because generally when people describe their experience, it comes out in the order of severity. At least this is what I've found. In terms of severity or urgency or importance, which says nothing for chronology, which actually makes it more difficult for us to hear and understand. So then you repeat it back in chronological order, and then they know that they've been heard. And so that way you're not looking at the screen,
Yes.
you're looking at them. And we all know from medical school, this is one of the things that I think was pretty universally taught when I was in medical school, which was that the patient thinks that you've spent more time with them if you're sitting rather than standing. And so they always feel like you're trying to leave if you're standing. So make sure to sit, but you're making the point even further. Try and make sure that you're on eye level. And if the computer is situated in such a way, it's really, the onus is really on you to situate yourself so that you can interact with the patient, whether that means using a laptop instead of the desktop, or right there are ways to do it if you take the
Absolutely. And I love, Brad, what you just said about taking the time to kind of understand the story and recount it back to patients. This is actually something when I was at ZocDoc is something that we taught to a lot of our reps who are on the phone speaking with customers, patients or doctors every day, is you want to understand what the problem is. And the best way to do that is to paraphrase it, or even sometimes just plain old repeat it back to them and say, okay, so this is what I've got so far, or this is what I hear you're saying, or just to make sure I've got this straight. And then you go back and you recount it. We have found in the customer service world that when you don't take the time to do that step, the two paths of what the customer is telling you or the patient is telling you and what you think they're telling you can diverge really quickly. And you may not even ever figure that out in the span of the interaction, right? You may, or if you're lucky, you might find it out at the end. So some people feel this is silly. It's like, why am I going to, the person said they were here for, a sinus infection. I'm going to say, okay, I just want to make sure I got this straight. So you're here for a sinus infection. Yes, that sounds a little bit silly, but, taking the time to make sure that you're repeating back or finding a way to acknowledge that back to the patient says, okay, we've established this relationship and we are on the same page.
I think that's hugely important also because very commonly there's a question behind the question, right? There's the question that they're asking, but then there's something kind of underneath there, maybe a bigger problem, maybe a more complicated one that they're really like, there's subtext there that they may not, and that putting that out there really clarifies a lot in the visit. So if you can figure that out at the beginning, if it really does exist, if there really is a question behind the question, then that also makes it, and then like it's in our financial best interest, because then you've just saved yourself a ton of time for the rest of the visit.
That's right.
By clarifying it and putting it out.
That's right. That's right. And I think when you take the time to do that, and when you're doing it with eye contact and you're sitting with them at eye level, you're kind of getting away from that classic kind of paternalistic view of the doctor-patient relationship, right? The one that says you are the patient and you are down here and I am the doctor and I am up here and I'm going to now tell you I'm going to tell you what to do. Some people are very comfortable, both doctors and patients are very comfortable with that relationship. The doctors that I like are the ones that can kind of, meet me on my level, connect with me as a person, and take the time to look at me and repeat that story back. So now they understand where I'm coming from, and then they can get onto the deeper parts of the conversation. Like you said, what is the story behind the story? Which then gets into deeper questions like, what are your goals for your health? What are your goals from this visit? What do if you've got, obviously you're here because, unless it's a basic checkup, you're here because something is broken. Something is not working the way you want it to work. So is this a simple fix, or is this going to be more complicated? And it's like, where do you want to be in, a month, 6 months, a year, depending on, what they're coming in for. And once you understand what their goals are, then I think the best thing you can do is you can present, okay, based on what your goals are, these are what your options are. And we can have a dialogue about what you feel is the best for you and what I feel is the best for you. And now we're really having a conversation, right? You're still the authority, you're still the doctor, but I feel like, oh my gosh, you really took the time to understand me. You asked me questions that maybe no doctor has asked me before. And I think all of that can happen when you're really taking the time to establish that relationship. So taking that deep breath before you go in, introducing yourself to patients and family, continuing to make eye contact to all of them, sitting at eye level, making sure you're recounting their story back to them and getting to them about what their ultimate goals are.
So I think this is what we're describing right now is similar to that book, How to Win Friends and Influence People, which is full of truisms, right? Like people like hearing their own name. People like when you smile at them. People like, right? Like things that everybody knows, but most of us don't do. So I think, how do we make that stuff happen? My suggestion, and I'd be interested in your feedback on this, would actually be put a little sticky note somewhere where you go. I mean, I have my laptop where after I leave the patient room, this is where I type, this is where I return phone calls. And what I'm going to set up after this interview is I'm just going to put a little sticky note on the counter, and it's going to say, take a deep breath, introduce yourself, look them in the eye, face them, recount their story.
Yeah.
So that between each appointment, I look at that and remember to do that. And that's going to need to be there for a couple of months
For sure.
until it starts to happen every time. And if you genuinely want to do these things each time, you need to develop them into a habit. And in order to develop them into the habit, you need to do them over and over and over and over. And I think it's important to not just go, yeah, I'll start doing that, to genuinely commit to changing your behavior. At least I need to, because I certainly don't do all of these things right now. And if I'm going to improve my relationships with my patients, then I need to do them. I'm going to do that so that I don't forget, because otherwise I'll start running behind, I'll get frustrated, I will forget, and I'll just go back to what I was doing before, which obviates this entire conversation. So I certainly don't want that.
Absolutely. And, I say all these steps and you outline them on a Post-it note as if they are simple, but they're not for some people. Many people might say, I didn't get into medicine to create these, gushy relationships with people. I came into I got into medicine because I wanted to fix things that were broken, but as I said before, patients do have a choice as to who they're going to see. And whether we like it or not, patients are saying that what is important to them is not just their clinical care. They expect you to be clinically, wise and put them on the right path. But the honest truth of the matter is that even if you're wrong, if you have taken the time to really establish a relationship with your patient, they will often let that go. And that's the same for a lot of different areas. If you've got someone that's nice, you will forgive a lot of stuff. But there's been studies that have shown that surgeons and primary care doctors they're sued less by patients that had really good bedside manner and really good communication, really good rapport and respect for the patients. Like they do it less. They say
they're less likely to sue someone that you like.
That's right. They say
it won't make it completely go away, but it'll decrease the risk.
They say, you know what? I don't care. I don't care if he did this thing wrong. I love him. So we were talking about some of these potentially simple things, but the tricky thing, the hard one, is the empathy component. And that is, I think that can be challenging for anybody to, empathy is not the same as sympathy, right? It's really putting yourself in patients' shoes, understanding where they're coming from, not judging them, because patients are savvy and can tell when you're judging them. But it is absolutely a muscle that requires time and effort. And I think it's challenging for a number of reasons. One of them, and I was talking to someone in our hospital about this recently, he brought this up and I thought it was a really good point, is that as doctors or healthcare professionals even, we may not have the best understanding of truly what the patient experience is, because so you're affiliated with a hospital, right?
Yes.
Yeah. So if God forbid your children or your wife or someone or a family member gets sick and you take them to the emergency department of your hospital, chances are you're probably going to say to them, by the way, I'm Dr. Brad Block. I have privileges here, et cetera, et cetera. And why wouldn't you? Like I would at my own hospital, I would do that. And I'm nobody, but I would go in and say, I'm the patient experience coordinator here, blah, blah, blah. Because at that moment, I want to get I want the best possible clinical outcome. And I want to use anything in my arsenal to try and get me specialized care. I become very selfish in that scenario. But we'll use that if I feel like anybody in healthcare will use any trick that they can have at their disposal to try and get the best possible care. But you got to think about what it's like for somebody who has no pull, who has no connections, who doesn't know that building, who is, and also has the same things that we have, which is that they're in pain and they're frightened. So I think we have to really think about what is this like? What is this like for this patient? Even our patients who come in seeking narcotics, drug seeking patients. Obviously, every facility has their share of them, but we still have to try and understand those people. And if we judge them, they'll come back and they'll tell us. They'll say, "I was made to feel like I was a drug seeker. I was feel less than." And so, empathy is really the trickiest of the things that I think we all need to work on. And if we can work to understand where patients are coming from, the whole length of our relationship with them is going to be a lot stronger.
Do you have anything that you could recommend for us that would help with that? Where that might help me connect with my patients a bit better, make them feel that I'm connecting with them?
Well, I think it's kind of the things that we talked about before, some of those steps. But I think and this is something that we also, taught at ZocDoc, is that, you can let people know that you understand where they're coming from. You can say, I'm sorry, that must be really frustrating for you. Something like that. I think even just acknowledging that, because we can acknowledge, all day long that someone has a specific injury, a specific malady, right? But taking the time to acknowledge what those feelings are behind it, sort of kind of like the story behind the story, like you said before. I think that can help, is actually putting words to it and letting patients know that you understand where they are, right? Like I said, this whole thing is about meeting them where they are, understanding what their fears and their goals are, but saying, I understand that this is a lot of information I'm giving you, and I can understand that might be scary for you.
So I think this actually leads into a common patient complaint, which is when we're running behind. So I think we can like meeting them where they are.
Mm-hmm.
So I think a lot of times when I'm running behind, my impulse is to maybe explain why I'm running behind. Oh, there was a complicated patient, there was an emergency, a bunch of people showed up late, something like that, explaining. So that's not meeting them where they are. That's
Right.
having them meet me where
That's
I
right.
am.
They don't care.
Yeah, exactly. So, so I think to that effect, meeting them where they are would be more just apologizing and saying, listen, because they don't want to, nobody likes to feel like they're not valued, right? You spoke
That's
about
right.
that earlier.
That's right.
Like they're not cared about. So if I've just made someone wait for an hour, that person feels like I have zero regard for their time and zero regard for anything about them. So how are they going to trust me to take care of them if they think I just don't care about their time at all? So I think in that situation, my inclination is to try to explain myself, but really what I should be doing from what you're saying is, listen, I'm really sorry. I just want you to recognize that I do value your time and I feel terrible or terribly that you've been made to wait this long. And I'm trying, I don't even know if I should say that. I'm trying to do my best, or I'm trying to keep up, or just apologize.
I saw something on Twitter of all places recently that said, what if we reframed it, instead of apologizing, instead of saying, sorry, I'm late, we said, thank you for waiting for me. Right. We took the
Oh,
negative.
that's interesting.
I just thought about this. We take the negativity out of it. We take the negativity of a word like sorry out of it, and we express gratitude for their patience. And you don't have to, I think you're on the right track here. Like, I don't think you don't need to fall on your sword about it. You can say, I understand your time is valuable. Thank you for waiting for me. I'm sorry I'm late. Even if you want to say that, and then what you do is everything you do from that moment on proves that they're the most important person. When my first daughter was born, my wife's OBGYN, uh, a, a really well-known OBGYN in Manhattan, and this guy is notorious. His patients wait anywhere from an hour to like 2.5 hours. And every time we were in that waiting room, I sat there cursing him under my breath. I'm like, I can't believe this guy's making us wait. My time is valuable. I took off of work. When we got in the room, he made us feel like we were the only people that mattered in his world. And this is a guy who had like celebrity patients on the walls, right? We felt like one of these people. He spent a lot of time with us. He never made it feel like he had to get out the door and see the 20 other patients that had been waiting 2 hours. He spent as much time with us as we needed. And every single time I walked out of the appointment, I was like, I love that guy. Like it was totally okay. And I wound up justifying it to myself. I'm like, well, I can see why we had to wait so long. It's because he spends all this time with patients. That's an extreme scenario, right?
Yeah, I don't think we should be
No.
highlighting that as something that
No.
our
I'm
listeners
not
should be
saying, I'm not
doing.
saying take all the time, but here's the
I
thing,
think,
right? You don't
yeah.
have to take all that time. You just have to make sure that the time that you are taking is really quality time.
Well, you're not distracted, right? You're spending minimal time looking at your computer. as, as minimum, yeah. And you're really, and I think to that effect, the eye contact is really important, right? Like if you're not distracted by other things, then you shouldn't be distracted by other things. And it's sometimes, you know, maybe you're trying to document as you're talking to them, and sometimes there are ways to do that maybe I'm just trying to think of myself as the example. Maybe I shouldn't be documenting things that they're saying as they're saying them, because then it seems like I'm playing Minesweeper when I should be, when I'm, just really just typing in
Right.
what they're saying. But yeah, if you're really absorbed in what they're saying, then it makes them seem like they're the most important thing in the room and the most important thing in the world, if you're really that focused on them. And I think there are ways to really practice that. And I think that should end up on my little index card too, right? Just don't be distracted.
That's right. And if you're concerned about what they're going to think about you playing Minesweeper, that's a simple one too. You can say, so listen, the way I generally do things is I don't want to miss anything. So I take a lot of notes. I type a lot while I'm listening, and you've got my full attention. I'm just typing at the same time. If that becomes a distraction for you, let me know. Something like that. Now you've put it out there. Now they don't have to worry. Is he playing Minesweeper? Is he typing an email? Like you've told them what it is you're doing and why you're doing it. Obviously I would suggest that any doctor, if they're not in this space already, is get comfortable with typing, but also looking at someone while you're typing. Like I can do that at this point. So I can look at somebody in the eye and completely just type, and I can correct my typos later, but just let patients know what you're doing. Don't assume that they know. And once it's out there, then okay, it's fine.
Great. Great, great. So far, I think we've gotten a lot of recommendations from you that are pretty high return on investment. So, they don't seem like a whole lot of effort, but they will really end up paying off in the long run if we can turn them into habits. Do you think there's anything else that you think that we could do that would be high return on investment? One thing that we had spoken about before the interview was how we treat our staff. So, in our offices, there are multiple levels before the patients get to us. There are the people answering the phone. There are the people greeting them and entering their information. Then maybe you have a nurse or a medical assistant or a physician assistant before they finally see the doctor. And so, what are some high yield things that we can do to make sure that those people as well are maximizing the patient experience?
Absolutely. Because like I said in the beginning, right, it's about the entire continuum of care. And that involves absolutely everybody. So this is where I see patient experience going in the future is all of these different areas, from people, from the doctors to the nurses to the housekeeping staff to the dietary staff, if you're in a hospital, finding ways that they can intersect and meet patients where they are, right? So when it comes to, nurses and PCAs, techs, things like that, they're a big part of this as well, especially in a hospital setting, because in a hospital setting, they're going to see the patients a lot more than the doctors. And quite honestly, those other staff, they can often make or break the experience. So I think what that requires a connected team. That's not necessarily easy to do, but I think really pays off, right? You have to have a staff of people that feel like they are all playing on the same team. In Atul Gawande's book, The Checklist Manifesto, he talks about how before surgeries, the entire care team would stand there and they would all introduce themselves and what their role was. And this felt awkward and silly for some people, but it ultimately made people feel like they were part of a team, even when some of them had never even worked together before. So what that requires people, the office staff and nurses and all the medical assistants, all of those people to be made to feel as if they are just as important in the patient care. It requires people to treat each other with respect and dignity. Everyone in this way, I like to say everyone is basically a patient, right? Like you have to treat everybody that way. But if everybody feels like they're playing for the same team, if nurses feel like they are being treated with the same amount of respect, as doctors are, if they feel like the doctors are treating them well. If the office staff feels that too, and everyone's really working for the same team, and that team is the patient-centered care team, then then I think that goes a long way. But when there are separations between those teams, when people don't feel like they're important, that their roles don't have value and meaning, that's when you see people, I think, start to check out. And the other thing that I'll say, and is obviously being in healthcare is really difficult. You're seeing people who are generally not they're not the best versions of themselves when they're coming into the office, right? They may be they're like I said, they're hurt, they're frightened, they're scared, they're in pain. They're probably not presenting their best versions, and they may take it out on you, and that is not easy to handle, and that can really burn people out. But the thing that stops them from getting burned out is if you have a team around them that take care of each other. That creates engagement. So really, you need like team engagement there. I make that sound very simple. It's not.
Exactly. So what I was going to ask is if there's something concrete that you could recommend that we do in order to make these other staff members feel valued, feel like part of the team, feel like they're on equal footing.
Sure. Make eye contact. No, I mean, but I'm half joking, but I am also serious. Like, when if we're talking about an office setting, when you walk in the morning, and I'm not talking about you, Brett, I'm talking about the general you. When you walk in the morning, are you taking the time to say hello to the people you work with? Are you making eye?
I know you're talking.
I am talking. Yeah, I actually am talking about you. Are you making eye contact with them? Are you talking to them, asking them how their day? It, as a quick aside here, when I was working at ZocDoc, at some point in my role there, I started blocking off the first 15 minutes of my day. And I know not everybody can do this. I would block off the first 15 minutes of my day to just talk to everybody on my team, just because I kind of wanted to, and I wanted to see how they were. And when surveys came back about my performance, about like what I should keep doing, that was like the unanimous number one thing that people said I should keep doing. I should keep coming in.
So basically they were like, I want to just keep talking about me. So here's my feedback. In the morning, he asks me about me. I want more of that. I want to keep talking about me.
Well, what they want is they want to feel like this is not just, I am this person up here and you are this person again. It's not the paternalistic relationship, right? It's saying our relationship goes beyond just you answer the phones and I treat the patients.
So if I may make a suggestion, so what I would recommend, and granted, I have no expertise in this. All of my expertise is in ear, nose, and throat doctoring and surgery. But would be for those staff members, you should know their names, you should know their spouses' names, you should know their children's names, and if they have something, like some of them are studying to be an ultrasound tech, some of them are studying to go to PA school, some of them are, right, if they have some aspiration or just know something.
Yep.
Know their family members' names so that you can ask them about them, and then know just something additional about themselves so you can ask. So if you're able to ask them that, then that shows that you genuinely care about them as a person, and their work will ultimately reflect that.
Absolutely.
So as far as like a concrete step that you can take, should be that.
Sure. Yeah, because they'll want to do a better job for you. They don't want to let your patients down. You've created a level of respect there. And I hope people aren't rolling their eyes at this thought of doing these things. And you know what? If it doesn't feel natural, fake it a little bit, and the more that you do it, the more natural it will become. People will at least see that you're trying, which is an important thing. But yeah, get to know those people. Even if it's just, like you said, even if it's just a small thing or two, that creates a relationship. All we're trying to do here is create relationships.
So as a little bit of an aside, I'm going to end the podcast just talking about myself. So the reason that I became interested in even having this podcast is that my wife, whenever I would go to some social event with her, she would just kind of float around the room and then leave the party, and everyone felt like they had a new best friend in her. And she loves that type of setting where she can just interact with new people, and she's genuinely concerned about about everybody.
This is why
she finds all of them interesting. And
yeah, this is why your wife and my wife get along so well.
Exactly. But if and you know me forever, for a very long time, until only recently, I was a curmudgeon, right? I didn't want to interact with other people. I was angry. I listened to heavy metal. I had a frown on my face all the time. Like I was just an angry guy that didn't want to interact with anybody. And I thought it was because I didn't want to interact with anybody, but it was really because I was not good at it, which set up this negative reinforcement cycle of I'm not good at it, but really I'm going to rationalize it that I don't like it. And so then I just avoided it and it just, went downhill from there. But when I started learning more about it and, observing my wife and reading, and as I got better at it, I enjoyed it more, and then I got better at it, and I enjoyed it more, and I'm certainly that translates into my patient's experience as well because I try to apply those interaction skills to that interaction, and I think it's helped me. And this is one of the main reasons that I've launched this podcast is I think that in medicine we really have a lot to learn, and myself included. In that space. So I think we only scratched the surface. We've been at this for over 40 minutes. And it feels like time just went by in a second. So I really, Jason, I appreciate you taking the time out of your busy schedule to talk to me for this interview. I'd certainly love to have you back again where we can talk about other things, patient experience related. And thank you very much.
Thanks so much for having me, Brad. It's been a great conversation.
That was Dr. Bradley Block at the Physician's Guide to Doctoring. Find all previous episodes on iTunes, Stitcher, Google Podcasts, or wherever you get your podcasts, and write us a review. You can also visit us on Facebook at facebook.com/Physician's Guide to Doctoring. If you're interested in being a guest or have a question for a prior guest, send a message or post a comment.